Hi everyone, in this video we will discuss about the systems approach to nutritional care, overview of the system, components of the system. So first, what is the systems all we discuss here. So, healthcare is the product of a complex adaptive system of people, equipment, process, and institutions working together. Problems can arise with either deficiencies in individual system elements or in their relationship with each other, and improving the overall function of such a system can be challenging. This insight, a system view of healthcare reforms our understanding as to how care is delivered and can be improved. Systems that work do not just happen, they need to be planned, designed, and built. So, seem like that nutrition intervention is not happening in one day thing. We have to plan, design based on the requirement and how to implement and how to assess the outcomes of that one. Is it really useful the community or people they accepted or not? We have to assess based on these systems. So critics of a system's approach to healthcare might urge that it is simply a mechanism to absolve individuals where they have made mistakes or acted inappropriately. So, or that it is an excuse to paint improvement as too difficult to attempt. So, we urge instead that a systems approach should seek to answer fundamental questions about the people involved in a given situation, the wide system in which they operate, the opportunities for risk, and what can be designed to mitigate these. So, there will be occasions where individuals are culpable, where machines fail, or where processes are weak. The system should be designed to reduce the possible harm which results. So, more optimistically, perhaps robust systems offer the opportunity for increased quality and efficiency resources. So, what is the need for the systems approach? So, in the World Health Report 2000 had a primary focus on health systems. This report on global health system began to address questions around the elements of a good health system and the monitoring of system performance. So, in the following few years, high-profile reports were published in both in the USA and the UK that were significantly challenged the status and the quality of that justify the need for a better approach to improving the quality of the healthcare delivery system in these countries. Not in these countries, almost all countries are needed permanent structure for the healthcare systems. In this way, same system approach is needed for nutrition healthcare system. So, in this slide, we may observe realizing a systems approach in practice. A systems approach has also been described as a framework for seeing interrelationship rather than things, for seeing patterns rather than static snapshots. It is a set of general principles spanning fields as diverse as physical and social sciences, engineering and management, and also in the nutrition. In this, we may identify what is the constraints, and based on the constraints, we have to understand the solution for the space and what is the requirements are needed. So based on that, we have to design and specify that one in the acceptable form, and also we have to verify what we designed. So these are all based on the need based one. So understanding the problem space, and finally we have to assess the system value, and also assess the system cost and also risk. Is it in the low cost one or a high cost one? So this is usable for all economic population one. So like that we have to check this systems approach in the nutrition care process also we have to check all these approaches. So the elements of a systems approach, mainly perspective elements, they are given in the description. So people, the understanding of interaction among humans and other elements of a system in order to optimize human well-being and overall system performance. So perspective is another one is systems, the means to address complex and uncertain problems involving highly interconnected technical and social entities that produce emergent behavior. So based on this design, what they are developing is the identification of the right problem to solve certain solution options, and also refinement of the best one and appropriate solution to the problem have to design. So in this one, risk is also there. So the management of what can go wrong based on the identification, assessment, and management of hazards and opportunities present within the system. So these are all the elements of the systems approach. So here in the first picture, we may identify a spiral model of the questions that define an mainly interactive approach to the healthcare improvement. Same thing we may applicable for the nutrition care process also. First, what is the problem, who will use the system, where is the system, what affects the system, who should be involved, who are the stakeholders, what does good look like, what are the elements, what are the needs, how can the needs be met, how will are the needs met, and also what could go wrong, and how does the system perform. So same questions we have to raise in the nutrition care process also. When we are planning a nutrition intervention plan, we have to question and we have to answer all these things in that intervention plan. So in the second picture, we may identify linear improvement process transferring current performance into measurably better state. So current performance. So what is the triggering point? How to identify based on that case? How to design the plan that will be delivered, and that should be in the form of acceptable form, and how is it sustainable or not. When we may identify based on the outcomes. So based on the better measurable outcomes, if we get automatically the whatever design is planned, that is success. Based on this, we may identify in the nutrition care process and in the nutrition intervention also. So the critical stages of an improvement approach is stage is understand description leads to description of the current system, a common understanding of the problem, a conscious view what the future system might look like, and a clearly articulated case for changing the system, like that how to improve the approach. So whatever plan you are planning is in the understandable form, and also design leads to a clear description of the future system, not only for the present solution, it is also for the future system. Based on the interactive design of the system architecture, which its elements and interfaces, the evaluation through successive prototype. So design has to design plan based on the future prospects also, not only present requirements. So deliver leads to the successful development of the new system with the levels of measurement necessary to evidence its success and acceptance, that it achieve appropriate value for its stakeholders. So sustainability has to measure. It leads to the continued operational success of the new system along with the consideration of further improvement potential or wide development. So, here in this slide, we may observe some factors that promote or inhibit optimal nutritional care from the perspective of the production kitchen, the ward, and the hospital management. Some promotive factors and inhibitory factors is there. The production kitchen perspective way, so frequent contact to the nurse, staff, and the patient is needed. Sometimes inhibitory one lacking is there, that the kitchen follows the food right until it's served to the patient, that the kitchen does not follow or have any influence on how the food is served. High visibility within the organization and hence the possibility to enhance knowledge, all these come under the perspective factors. Low visibility will come under inhibitory factor. Hospital words perspective, that the professionally trained person works actively with nutritional care and has necessary time to do so in practice. The presence of key personnel or committed individual is needed. 24 by 7 they have to work, and staff serve the food items to the patients based on the needs. So this is all come under the perspective factors. So in the inhibitory factors, lack of time for nutritional care one, and that responsibility for the practical implementation of nutritional care is collective, but that only few are actively engaged, and that formal responsibility for nutritional care lies with the physicians who rarely involve themselves in nutritional issues. These are all the inhibitory factors. The hospital management perspectives are clear signals from the management about the importance of nutritional care, and access to management tools and the quality assurance support, assessment, nutritional care resource to follow up supplementation, and implementation of nutritional care guidelines. These are all the perspective factors of this nutritional care management system. But inhibitory factors, weaker or lacking signals from the management about the importance of nutritional care, absence of management tools, or obtaining the insight to be able to assess nutritional care at department level. These are all the inhibitory factors. So based on this, how to identify perspective factors and also correct the systems in the nutritional department in hospitals and also institutions. So these are some factors that promote or inhibit optimal nutritional care from the perspective of the patients. So promotive factors, that the patient has a real choice of menu at mealtime is a thing, and there is no choice. Some problem is the inhibitory factor, that the meal is adapted to the patient, for example with the respect to consistency and size of proportion is all the thing, so that the patient is not offered between meal snacks and oral nutrition supplements for 12 of the 24 hours in a day is the inhibitory factor, that the patient is informed about what the production of kitchen can offer is the promotive factor, that the patient is not informed about what the production kitchen can offer. And also dialogue between the patient and nurse is very very important. Inhibitory one is there is no dialogue between the patient and the nurse. The presentation of the meal is appealing is the promotive factor. Patient's nutritional status is not monitored, and patient knowledge of his her own weight loss is not utilized by the nursing staff, all come under the inhibitory factor. So these are all we have to correct in the management systems. So nowadays engineering toolkits are available. It means softwares are available for better management of the nutritional care system. So the focus here is on definition of a range of simple but effective interventions to identify a real need, define a problem, and a business case for change, develop viable solutions, and deliver the preferred solution into practice is the main thing. So for better nutritional care management, we may adapt new toolkits and also new softwares whatever is available we may utilize that one. We may send reminders to the patient. We may change the systems approach, whatever older systems are there. We may utilize the systems. Nowadays almost majority are using smartphones. So like this we may improvise the nutritional care system of the patients. Thank you.